Julian, this pregabalin that you're trialing, is that Lyrica? Right.
So that's the generic. Sorry, the trade name is Lyrica.
I've actually tried gabapentin 6 years ago, and I found that it made my legs feel like lead. I couldn't walk. Will I get the same result with this pregabalin?
Possibly.
You think
Did you have any other side effects from gabapentin? Did it make you sleepy or anything like that?
No, but I didn't have any positive effects either.
Were you on a whopping dose?
I can't remember. It was 6 years ago. I can't
You
remember.
need-
Same effect as we were talking about it earlier. The same thing. Really, really heavy legs that felt like lead and no symptom relief. Really.
You on it for a while?
Oh, several months.
Okay. Gave it a good shot. Haven't heard of it. Trying to work out why that would be.
It just made your legs feel like they're really heavy all the time. It's just
Really difficult to walk. It was an effort.
So, do both of you have a sensation of tremor in your legs, or do you just get feeling unstable? Can't explain it. You know, some people get they complain, I've got shaky legs and problems walking, and I've had other patients come along insidiously saying, I've just got a balance problem, and you put the electrodes on and you get the noise.
No,
So-
I've got
Have you tried anything else that's helped?
by accident I have tried something, but I haven't pursued it. And I was travelling and I pulled a muscle, and I went into a pharmacist and said, I just need something to get rid of this pain. I need to be able to walk. And so he gave me some Voltaren, 50 milligrams, and he said, go and take 2. And so I did, and also I was with some guests, and they wanted to give me a glass of sangria.
that'll fix it.
That's a confounding effect of alcohol.
Plus the 2 Voltarens. And on return, I was able to stand on a train for 10 minutes. And I did have this most euphoric feeling. I felt at the time, my goodness, if this is what being on drugs feels like, I could do it. It was just wonderful.
Who is this?
Then
I'm
I
confused
had-
now. Is it the sangria or the Voltaren?
I don't know, but I had
And did the
another...
Voltaren work again?
Well, yes, it did, and this is really quite embarrassing because, again, I was away, and I had a grandson in the room in the evening, and I just didn't want to turn on the light, and I went to take 4 Senecot. Yeah, okay, 4 Senecot. But I had Voltaren in there because I always travel with that now as well, and I took 4 Voltaren 50 milligrams, which is 200 milligrams. The next day, I sort of didn't notice it a great deal, but wondered why on earth the 4 Senecot hadn't worked. So I repeated it the following night, and I must say that I slept like a log. I hit the pillow, and it was wonderful. The next day, my daughter said, Mum, she said, you're really good today, aren't you? And I thought, yes, I am. So there's something in Voltaren that works for me.
Unless there was some element of joint pain. So I didn't mention, but adrenaline, the reason you get amped up, upset, adrenaline and adrenaline-like compounds increase any background tremor. And for example, pain, if you're in pain, your tremor will get worse because you're releasing more of those activating kind of chemicals. So possibly through that pain activating mechanism. Not sure.
Didn't totally implement, but it just helped.
I mean, if you get sore muscles from having orthostatic tremor, you know,
No, I don't.
ligaments
No. It was just.
So yeah, I
pulling
can't answer that one. My story's...
well, if I was a scientist, I would sort of work out what the drugs were, and maybe there's something that.
Everyone should
for
try it
me.
tonight. All right, any other questions on the
It affects your stomach.
Sorry, red jumper?
Yeah, I'm just sort of thinking off beam a bit, but you can get some headphones these days which are noise cancelling headphones, which will cancel out background noise, and I'm just wondering if you could put a little, a TENS machine that just fires off at 16 hertz in the other direction. Maybe you could cancel out the a negative amplitude
Yeah.
Or
that's why I was
whatever.
asking if there's any signal processing sound engineers. And there's another study I want to do with whole body vibration. Yep, so we'll get to that in the treatment bit, I reckon. Anything else?
Can I just ask,
Oh, yes. Oh, I need that.
anyone else in the room, apart from her and I, getting Meniere's disease? Meniere's in the ear? No?
I have,
Separate disease.
I noticed,
Yeah.
yeah, but
So it's a double hit.
we've both got it. And I got it well before, and I'm getting it again now. So I don't know if it's got anything to do with the sort of cochlea and the fluid in the ear being unstable now.
Well, I would say that's a combination of a common disease and a rare disease,
Yeah.
both affecting your
Yeah.
balance system.
Julian, I discovered my migraines because I was working part-time because I'm very stubborn, because I said I have these tremors, but I'm going to keep working. I'm going to keep working, even if I was very bad. And I was at work and I had this big bang in my head, right here. And I thought, oops, it could be a mini stroke. I had, with that bang, I had a stroke, but I didn't know it was a stroke.
So what was your question about the science?
And yeah, because Joseph kept telling me that my balance is my ear.
Well, it's
4 years ago, I had a tumor taken out of my ear with that bang thing. Because
your story is very hard to make sense of. It's complicated neurology, and unfortunately, neurology can be more than one cause. They all interact.
Yeah,
you may or may not get to the bottom of it. You've got a neuropathy, a stroke, and everything else.
Yeah, and I had the tumor, and then I have tinnitus from that thing, and often I get my diamonds inside, and call it like that, sorry, and they get out of the cage, and I suffer from benign paralysis or whatever.
That's it. Then it's another condition.
Yeah. And I get unbalanced. And so Joseph said to me,
Nicola?
don't.
Sorry, we're going to take some more questions on the talk before.
I'm just asking, I'd just like to know if anyone here has had falls, going back to the falls part.
Yeah.
Is
Oh, yeah, that's a
anyone
good
here that
question.
had falls?
Well,
Nobody?
mine was due to a knee replacement.
Frequent falls, I'd ask. Not
Yeah,
ever.
I trip a lot.
What's the typical rate of onset of orthostatic tremor? I mean, and having a look at other people in the room, I seem to be very mild in my symptoms, but other people seem to have very, very severe symptoms. So what's the rate of onset, and is it age-related, or is it...
Hang on, do you mean that when it starts after you stand up, or
Yes,
how many seconds it takes, or...
when does it start to get worse?
How progressive is it, I guess?
All right.
What have you found?
Seems to be more common in older people.
Yes.
Nicola's the youngest person I've ever heard of having it. So hence the theory that it's some kind of breakdown for some reason in that postural control network. You know, maybe it's there is a normal aging of the vestibular system, the sensory inputs from the legs, the sensory nerves. You know, everyone who's 80 will have a bit of a peripheral neuropathy, a bit of a vestibulopathy, poor vision. So maybe everything's hanging in there up until this point, and it breaks down and orthostatic tremor emerges. But you know, if we're working on that theory, you've got to say you're unlucky for it to happen. You know, it's not a common way of the nervous system breaking down.
So
As
where
opposed
will I
to-
be when I'm 60?
Well,
Where's you are now?
I generally say to people, you know, if it's, you know, how it's progressed since it came on, it's probably how it's going to progress. But you know, there's a plateau effect There's only so much instability you can have. Like some people can't stand for 30 seconds. Some people just can't stand for a minute. It's not like you'll never be able to stand. It's just a question of tolerance. And using one treatment and adding another one in. Sorry, that's in the treatment talk. Science?
Can I ask another question?
Yeah.
My wife sometimes have good days and the next day won't be. So do you have good days better than everyone? It's not. Yeah, it's not bad days. It's okay.
I think the only thing that has changed in my mother was diagnosed with it, right? And then I've had it for 12 years. I think the only thing that has changed in those 12 years is when I first started to get it, you could touch the table and it stopped. That's gone. You know? Anyone had that?
How do you touch the table?
You're standing up.
You touch the table and the tremor stops.
I had that.
Yeah.
Your tremor's there and you touch the table.
That's right.
It
You
stops
just go to
it.
touch your wall.
That's now gone.
Just go like that and it stops.
Full weight on.
Easy.
Not actually the weight, just touch it. And it stops it.
On another side of the wall, it's a narrow way to make it one.
Professor here, Prince of Wales, he's actually
No, you didn't need to have
in
There's been a scientific study where patients were allowed to touch a little metal rod with their eyes closed, and even though the tremor still persisted, you just got that little bit of feedback from your fingertip. So that's what that is.
like a psychic branch, isn't it?
Is stress related to the onset of this?
No. I would say that, again, these things that, well, that you can, I've seen a lot of chronic conditions start after an operation, an accident, psychological trauma, and, when you try and backtrack and say, was it that stress that caused this degeneration or whatever, I would say, no, your body was under stress, your brain was under stress, I've seen people where things like, motor neuron disease started after a car crash or something, and you can just say, it was coincidence. In some cases, your tremor will appear for the first time when you're stressed out. I'll see people whose Parkinson's disease or tremor emerges after a depression. So they were, heading for it, and then there was some physical or mental stress, and it brought them down to here, and then it emerged. Does anyone disagree with that? Did yours start after a?
I'd say very stressful events have made it so much worse that you can see it as a constant thing, whereas previously stressful events, there were some of the symptoms, but they maybe have been adrenaline related, and it's going from occasionally getting it when you have a stressful event to having extreme stressful events, and then it's a constant.
Yeah, so I look at that as the disease progressing from intermittent symptoms popping up under stress to the stage where they're always there. Or not coping as well, I'd say, not completely coping.
Julian, I'm under Professor Colpatch here at the Prince of Wales Hospital.
That's who did the alcohol study and the finger on the rod study.
Yeah, well, he tells me I have more alcohol to drink, it'll help me. It's not. No, but with that finger one,
Did you do that?
I often go in there as a guinea pig, and that's one of the tests he's been doing on me, because with essential, you have it in your arms. My arms are as still as anything, but yet when I get my tremors, if I touch the table with one finger, it stops them. So he's doing a study on that on me at the moment. Every time I go in there, he has half a dozen students.
How long have you had it?
About 15 years. And that's one thing he can't work out, why it stops if you touch the table.
But we've just got to work out how to make that a practical treatment.
How to make it... Well, you can't walk around touch the table. But he's trying to work out how. I haven't got it here. And if I stand for too long, I end up getting it there. But if I touch the table, it goes.
pass. But I do know that there's categorised tremor as postural tremor, resting tremor, and action tremor, and there's different circuits underlying all of them. And orthostatic tremor is a postural, it's a unique postural tremor. So I can't entirely explain it, but the tremor in your upper limbs is a postural tremor with essential orthostatic tremor, but it's usually at half the frequency. So if it's 16 hertz in your leg, it's 8 in the hand. So there's some kind of damping effect from holding your hand out on the 16 hertz tremor, whereas in your legs...
It only has to be one finger.
Yeah, so maybe it's some damping thing. You have a exquisitely sensitive damping effect of activating... Yep, Nicola?
And he's been doing it with all these electronics things on me and that at the same time as getting me to touch the table.
This is a science question, I think. It's from the Facebook page, and they're saying, does the MTHFR clotting mutation have any relation to OT? That's science related a bit, isn't it?
That's the enzyme methyl tetrahydrofolate reductase, which is involved in making biochemistry happen. I can't really but I can't work out how it links into brain chemistry.
Well, then they said that the magnesium, if you go on magnesium, then it helps the muscles with the fatigue. So then if it helps it, is there something wrong with it? Do you know what I mean?
I've never found magnesium great for anything except cardiac arrhythmia.
It didn't help me. It's just a question on Facebook, but I found that there is quite a few of us that have that mutation though, like a similarity, like you're saying about the ears. It's just another...
What is it? What's that genetic test for? Like, why would... What's that?
I have no idea.
It's a failure of methylation, isn't it?
I don't know.
I'm sorry, what was that?
But what's the genetic... like?
Usually you need to supplement B6, B9, B12 because they're not methylated.
It's from treating it from a natural way rather than a chemical way. And I think that's where they were trying to get into the magnesiums and B12s and helping you that way.
Yeah, but was it done by a doctor for some specific reason?
Just because, for me, they did it for me because the gabapentin wasn't working, the Cifrol, the clonazepam, and then hence the magnesium didn't work, and then I found a Lyrica 3U. So I was at desperate points, and then I mentioned it on the Facebook page, and then there was all these others that said they had the same mutation. Just as maybe a thought to keep in the back of your mind. I don't know.
Yeah, the problem with DNA is that it's DNA.
Yeah.
And trying to join the dots, so there's the human...
But is that something that my parents would have passed down to me?
Well, you don't know, so you need to do a big family study and then work it out. And you can get mutations that are sporadic and appear in one person that aren't inherited. So you get sporadic genetic diseases, inherited genetic diseases.
Yeah.
You get polymorphisms or variation in your DNA code that are just normal. So they're now doing the human proteome, which is taking all the 22,000 genes in the Human Genome Project. It's taken a lot longer because they've got to make all these proteins and come up with tests for them.
Are doing gene studies for this?
No, not as far as I know.
Yeah.
Is that because they don't believe it's hereditary?
You're the first person I've heard that your mum's had it.
I thought I was. I was told I was. Dr. Sen from Prince of Wales said, no way in the world, couldn't happen. But it did. And then I contacted Nords, and they said yes, they are getting, from aunts to, it's mainly females, pass it down. So I'm getting mother to daughter. I said to Victor, I said, I think this is genetic. He said, no, it's not. Nords said, no, it's not. And then I get this phone call, has anyone else?
But it could be genetic in you.
Yeah.
And not other people.
That's
so
right.
I see this in Parkinson's disease. Parkinson's disease, the genetics, there's been a whole lot of work done on that, but all the data's there, but there's still interpretation problems. So there's a gene mutation that exists in one family and it's dominant, so everyone gets it if it's passed on. There's risk genes that they're at higher percentage in patients with the disease. So you can do these studies, and still get this result, and you're not sure what to do with it, like this methyl-hethyl thing, what does that gene do? So a lot of...
That people were having problems with achieving pregnancy, so it's, it's just stopping, it's more related to fertility.
Yeah, I mean, all that stuff's over my head, so I try and work on the symptoms, so the things I can measure, and then the treatments I can access. Whether genetic causes will be found to be relevant, maybe, maybe not. The general party line is that if it occurs younger in life, then it's probably more likely to be genetic, but there's still an interaction between genes and environment. So you can have a genetic mutation where you don't deal with environmental factors, toxins or whatever, or susceptibility to having Meniere's disease triggering off orthostatic tremor, things like this might exist.
Julian, there seems to have been a lot of work done on Parkinson's disease, probably because it's a more prevalent illness, but how related is orthostatic tremor to Parkinson's? And
good one. So I didn't mention in the science, there's been a few little studies, I just will pop up the PDFs, suggesting that there is this overlap. That was I'll put that up in the gadget section.
After lunch?
Yes.
Actually,
no, we should move on. But what was that again?
the relationship of Parkinson's
Oh yeah,
disease and
tricky. People have done dopamine transporter imaging in orthostatic tremor, which is generally a test to pick up Parkinson's disease, and said it is reduced, but not in a severe way. There's been patients who've been followed up for a long, long time and not developed Parkinson's disease. And there are some patients that, one of my patients after 20 odd years developed a completely different tremor, a resting tremor in her arm, while still getting a postural orthostatic tremor, and it responded to Matapar, which is a Parkinson's drug. But she is 85, and it's a common disease. When I say common, like 2%, that's still really common for the neurologist. So, she's doing well on the pregabalin and the Matapar now. So I don't think they're related necessarily, but in some people where they both develop, it is a bit suspicious. But it's more the latency. If someone developed a postural tremor and then 3 years later started shuffling and developed classical Parkinson's disease, I'd say that wasn't primary orthostatic tremor, that was secondary orthostatic tremor. So don't forget that there's secondary orthostatic tremor. It's been reported really with MS. You see it's like a handful of patients where it's presented with a lesion in the brain cell or something like that.
So there's
So
something
in primary
else.
orthostatic tremor, brain scan is normal, apart from age-related change. And that's my interpretation of it.
And you don't believe in no T plus?
Yeah.
There's that question again.
Well,
Clarify.
I think Anne's OT plus.
Yes, yeah.
It's something, 2 conditions affecting the postural control network. That's very suspicious, as opposed to getting Parkinson's disease and orthostatic tremor, which I can buy that they're unrelated if they're 20 years apart. But these are 2 very rare conditions, both affecting postural control and walking. What about OT plus things here?
Yeah, like the Parkinson, did I put Parkinson's or something? Or, like fibromyalgia and the others, the dysautonomia type of things.
Not really.
We really need to go to lunch because they'll run out of food
Oh, yeah.
to get up there. So should we break and then come back? It's just all right.